On behalf of International Pharmaceutical Federation, FIP, a warm welcome to everyone. Thank you to those who are joining us live, and thanks to those who will be listening in afterwards. I will also introduce our guests today in a short while. A warm welcome to all the guests, all the panelists today. I'm Mrs. Manjari Gharat. Can we go to the next slide, Shirley? I'm Mrs. Manjari Gharat from India. I'm the Vice President of International Pharmaceutical Federation and a Bureau member, as well as I'm the Vice President of Indian Pharmaceutical Association. As you know, the FIP's region is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. FIP's mission is to support global health by enabling advancement in pharmaceutical sciences, education, and practice. We are extremely pleased to be delivering this event today, the digital event, advocating for the role of pharmacists in diphtheria-tetanus-pertussis booster, COVID-19, and meningococcal meningitis vaccines. I'm extremely pleased and proud to introduce my co-moderator for today, Professor Ian Betts. He is the Chair of Pharmacy Education at University College London, and he's the Director of the FIP Global Pharmaceutical Observatory. Welcome, Professor Ian.
Thank you so much for that introduction, Manjari.
Thank you. Before we move to the program, I would just like to remind you that this event will be recorded, and the recording will be available later on our website, events.fip.org. And those who are listening in live, it's my sincere request to put all your questions in Q&A box, and our team will be picking up all your questions throughout the session. So please feel free to put your questions in the Q&A box. And now it's time for me to again welcome Ian. And Ian, it's all yours. Welcome again.
Thank you so much. And welcome to everybody who has joined us from all over the world to participate in this webinar today. Currently, we have over 120 participants, and we are all grateful for you giving up your time and sharing your expertise and your opinions in this critically important subject. FIP has been producing work on vaccination and public health for quite a while. Our most recent report in 2020 really highlighted the role of pharmacists in this area. And of course, the global pandemic, which is still ongoing in many areas, has seen a significant expansion of pharmacy-based vaccination and public health services in this area, and it's been and pharmacists have contributed a huge amount to the well-being and the prevention of pandemics, but also in a broader context, the contribution to a wider scope of public health, such as vaccinations for meningitis and other pathologies that we'll hear about later today. The Global Pharmaceutical Observatory of FIP is collating data all the time, and some of this data we're going to be reflecting back to you today. We also have an esteemed list of guest panelists who will be answering questions and providing their own expertise and opinion into this area later on. Our principal program at FIP is what we call our MNAP program, which is a multinational needs assessment program, which covers a number of thematic areas, including non-communicable diseases, education and training, workforce development. And today we're going to be focusing on our data from our vaccination work and our vaccination services work. This particular ongoing FIP program focuses on needs, as the name suggests, and feeds into our regional needs assessment and our production of advice and guidance and comparisons of global and regional needs for use by our members and our member organizations. We are aiming to focus on needs of nations in terms of practice and identifying, and exploring the expansions and the opportunities for expansions of pharmacist roles in the broader scope of vaccination and public health. And we will be discussing the need for an FIP-enabled transformation program for member organizations. And we'll be hearing more about that later. The earlier focus of our program, our project program, has been on groups of nations that have regulated pharmacy-based vaccination services. And the project is assessing the needs and evaluating the trends related to this in order to take up a consistent methodological approach so that the data contributes to a database that is useful and building a foundation for member organizations to consult and to adopt their own policies and to advocate for expansion of pharmacy-based roles. It is aligned with our One Fit program approach, looking at and focusing on priorities of our member associations. So the whole program this morning, the whole webinar this morning, I should say, is aligned to that. We're going to have a look at high-level overviews, roundtable discussions I mentioned, and my friend and colleague Manjiri is going to be helping with a panel discussion later on with a Q&A. Super good. I think the next slide shows us our thanks to sponsorship. This is an unrestricted sponsorship for this study. And so we thank Sanofi Pasteur for contributing to this aspect of global public health. I'll stress again, this is unrestricted funding that FIP has received to enable this work to go forwards. Good. I think this is our panel later on. We have one change to our panel. Zaid Kilani, my friend in Jordan, cannot be with us today, but it's a real pleasure to welcome Professor Rula Darwish, who will be taking on board that role in the panel later on. So welcome, Rula, and thank you so much indeed for your contribution. Good. I think we, Manjira, I think we move on to a video now. I'm going to be handing back to you, I think.
Yes, we go to the video now. The World Immunization Week is here. Shirley?
I contribute to protecting my community from vaccine-preventable diseases.
Ek ondersteun die doelwit van 'n lang lewe vir almal.
我致力于保护我的社群免受疫苗可预防的疾病的侵害。
I support the ambition of a long life for all.
Aitan kaitsta oma kogukonda vaktsiinvälditavate haiguste eest.
Eu suporto a ambição de uma longa vida para todos.
Apothekers leveren in Nederland een maatschappelijke bijdrage om met vaccins de bevolking te beschermen tegen infectieziektes.
Eu apoio a ambição de uma vida longa a todos.
I contribute to protecting my community from vaccine-preventable diseases.
Saya mendukung ambisi umur panjang untuk semua.
I support my community in protecting them against vaccine-preventable diseases.
وأدعم الطموح بحياة أكثر صحية للجميع.
I contribute to protecting my community from vaccine-preventable diseases.
Seja todos uma vida longa, cheia de saúde.
Halkımın aşıyla önlenebilir hastalıklardan korunmasına katkıda bulunuyorum.
אני תומך בשאיפה של חיים ארוכים ובריאים לכולם. תודה.
Je suis un pharmacien français et je contribue à protéger la population des maladies évitables par la vaccination.
Únete a la campaña de la Organización Mundial de la Salud, Long Life for All. Contamos contigo.
Long life for all. What a wonderful video. And it's really encouraging to see more number of countries where pharmacists are involved in immunization. So thanks to all of those who participated and contributed to this video. Now it's my great pleasure to inform you that we will have 4 of the colleagues from FIP who will be informing you about the high-level project that we carried out. So the overview of the project, and it's my pleasure to introduce Christopher John. He's the FIP lead for data and intelligence. Zheng Lum, he's the PhD candidate with National University of Singapore. Shirley Melianti, she is the FIP data and intelligence specialist. And Ali Jo Shipman, she's the Director, State Policy, National Alliance of State Pharmacy Associations, United States of America. So these colleagues are going to bring a high-level overview of the project which has been carried out and the report of which will be available later this year. So welcome, Christopher. Christopher.
Hello, thank you, Manjiri.
Yeah, thanks.
And welcome to everyone. Good morning, good afternoon, good evening, wherever you are. This is the project on the role of the pharmacists in diphtheria, tetanus, pertussis booster, COVID-19 and meningococcal vaccinations. If we move to the next slide, I'll be able to give you a bit of a setting of the scene for this project. What were the drivers for this project? Well, we know the importance of vaccines and immunization as one of the most effective interventions in population health. You've heard from our moderators earlier in the introduction and seen in the video that there was a huge task of vaccinating a high enough percentage of the nation's population around the world to reduce the public health threat of COVID-19. And this has meant coordination of new and existing services has had to be undertaken at an enormous scale in many countries. Pharmacists have already played an important role in the supply and administration of various vaccines, such as those for preventing the spread of influenza, and have been contributing to increased vaccination coverage in many nations' populations around the world. As you've heard, pharmacists' role in vaccinations is to improve vaccination coverage keeps expanding, and you'll see since the 2020 report that FIP produced, the number of countries and territories where pharmacists have gained the authority to administer vaccines has grown. But what about the pharmacist's role in the administration of booster vaccinations that do not induce lifelong immunity? And that includes diphtheria-tetanus-pertussis booster, and also meningococcal vaccines and COVID-19 vaccines. Next slide, please. So our aims for this project were to identify the current role of the pharmacist in DTP booster, COVID-19 and meningococcal meningitis vaccinations, and to establish factors, gaps, and needs for expanding the role in countries that already have regulated pharmacy-based vaccination services. You'll see in the blue boxes on the screen now, the objectives are described. They were to describe who can legally administer DTP booster, meningococcal and COVID-19 vaccinations, not only in community pharmacies, but outside community pharmacies as well. To identify the administration authority that was achieved for legally administering vaccines for pharmacists or for other pharmacy workforce cadres. To determine whether pharmacists can prescribe DTP booster, meningococcal and COVID-19 vaccinations. To indicate pharmacy access and input to patient vaccination records, to document those nations developing policy, legislation or regulations for an expanded role of the pharmacy workforce in vaccination services, and to list target population groups that the pharmacy workforce can vaccinate for DTP booster, meningococcal meningitis and COVID-19 vaccines. We're also explaining how pharmacists were reimbursed and illustrating drivers for their role in these vaccinations and also illustrating barriers that have prevented people from getting involved. So we've acquired a lot of additional information for leveraging the role of the pharmacists and pharmacies in increasing vaccination coverage, and that was a key objective. The project consists of two parts: a review of the literature and existing data on pharmacy-based vaccination services, and a survey of member organisations and selected non-member organisations of FIP in countries that have already regulated pharmacy-based vaccination services. And that's where my colleague Shirley will be updating you as we move to the next slide.
Thank you, Chris. Thank you for setting the scene. In the next few slides, what I will do, I will describe on how we conducted this project previously. We realized that there were a lot of literature outside about the role of pharmacies in vaccination, particularly since COVID-19 pandemic. So the first thing that we did was to conduct a desktop review. We conducted a literature search to find out which countries have already established existing pharmacy-based vaccination services. We also looking at the data that we have within our organizations to look at again, which country with existing pharmacy-based vaccination services, and also what kinds of research that have been done on these vaccination services, specifically for the DTP booster, meningitis, and also COVID-19 vaccines. And from this desktop review, we identified there were 46 countries that already has existing pharmacy-based vaccination services, and this will be our this was our targeted countries. We also identified that there were a lot of quite literature related to COVID-19, but not much related to the DTP booster and meningitis. So this could be a gap as well, where our project can fill. Following on the desktop review with these 46 countries, we then collect our data through surveying member organization and selected non-member organization. We send the survey, we distribute it for around a month until the end of February. As usual, we send weekly reminders to increase the response rate. And we also translated the survey to 4 languages. This is also to support and to increase with the response rate. For these 46 countries, we receive a total, actually 38 countries responded to our invitation. But one of the country, they mentioned to us that they didn't have pharmacy-based vaccination services, so we exclude that country. And another country also responded to us by giving us a letter sharing about the pharmacy-based vaccination services in their country, and we also include that country. So we only include countries who responded to our survey, which is a total of 36 countries. And from this data, we conducted the analysis based on the objectives that Chris already mentioned previously, and based on the vaccines that we are interested in, which is the DTP booster, meningitis, and COVID-19 vaccines. And today, in this event, we will share high-level findings of the study, and we will also launch a global report on this project, which contains also the findings later on this week. And we will also share with all of you today our interactive dashboard to show as well the summary of the findings as well, which my colleagues later on will share that. Okay, so this is the response that we obtained. As I mentioned earlier, we actually have a total of 38 countries responded, and we only included 36 countries. And as you can see here, actually, we have across regions responded to our survey. And the one in the bold here is actually the panelists that we selected today to share their experience in the pharmacy-based vaccination services in their country. And we select these panelists based on the current progress that they have. Some of them just started promoting and advocating for pharmacy-based vaccination services, and some others actually already established. So we will hear a lot of discussion today, which will be very interesting. Okay, so I will share now a little bit of the data related to the role of pharmacists in the administration itself. So from the 2020 report, we identified there were 26 countries already allow pharmacists to administer vaccines. And from this updated data, we actually within 2 years, we already have an additional 5 countries. And now we have around 31 countries already have established, already allow pharmacists to vaccinate, which is a quite high increase number only within 2 years, which is actually a good thing for our profession. These figures I want to share with all of you today about each specific vaccine. So for example, in terms of the DTP vaccines, we have 16 countries allow pharmacies to allow vaccines to be administered in the pharmacy, in the community pharmacy, and this is actually an additional of 6 countries from the 2020 report. For the COVID-19 vaccine itself, we can see here 20 countries have allowed pharmacies to vaccinate, which is only within since we established a pandemic in 2020, and it's already there. There were like 20 countries, which is quite a high number as well. And in terms of the meningococcal vaccines, similar to the DTP vaccine, there were 16 countries where vaccines can be administered in the pharmacy, in the community pharmacy, and this is also an additional of 7 countries from the 2020 report as well. Now, how about the prescribing itself? So, in terms of the in terms of the pharmacist's role in prescribing vaccines, there were also an increase. Previously, in 2020 report, we have 11 countries, and now we have 18 countries allow pharmacists to prescribe some specific vaccines. And in the table, in the table on the right hand side, you may see some countries for its specific vaccines that we will focus on today's and also in our report. And the asterisk here, meaning there were like some variation in the authorities across the country itself. So that's about the administration and also the prescribing. And as you can see, there were a lot of progress actually. Countries who start advocating pharmacies to allow pharmacies to vaccinate. And one thing that I also would like to highlight here, we also asked to the countries how can they achieve this? How can they start with the how can they allow pharmacies to administer the vaccines? And some of the respondents actually mentioned this was achieved through legislative, regulatory, and also advocacy effort. And actually, one of our member organizations stated that global effort and advocacy effort from other countries actually indirectly supported a change in policy in their setting, which is actually a very good thing to hear and to listen today. So that's a high-level overview of the administration and the prescribing, and I will now hand over to my colleague Elijo, who will present the rest of the result. Elijo, the floor is yours.
Thank you so much, Shirley. Can we go to the next slide? Thank you. So in order to fully realize the role of pharmacists and pharmacies in vaccination services, pharmacists do need to have full access to recording and reporting or sharing capabilities for vaccination records as well. So based on the survey results, this is still an area that needs significant intervention to remove barriers to optimize the role of the pharmacist in vaccination. Less than half of the countries that responded allow pharmacists to access, record, and or report in a patient's vaccination record for diphtheria-tetanus-pertussis booster and meningococcal meningitis vaccines. However, significantly more countries, approximately double that number, have authorized pharmacists access to recording and reporting capabilities in vaccination records for COVID-19 vaccines. So as you can see in the 2 figures here, of the participating countries in the survey, pharmacists have access to all or some records in 13 countries for diphtheria, tetanus, and pertussis booster vaccinations and 12 for meningococcal vaccines, compared to double that, 24 countries for COVID-19. In the second figure, you can see pharmacists can record in vaccination records in 12 countries for diphtheria-tetanus-pertussis, 11 for meningococcal, and again, compared to 24 countries for COVID-19. So next slide. As you can see here, the difference is even more dramatic when you're looking at reporting or sharing those records. 8 countries for diphtheria-tetanus-pertussis and 9 for meningococcal, compared again to 24 countries for COVID-19. So hopefully we will be able to see that access, recording, and reporting capabilities for vaccination records follow the trends that seem to have been set by COVID-19, and we'll see a greater expansion for all vaccines and for additional vaccines in the future. Next slide. All right. So while significant strides have been made in achieving vaccination authority for pharmacists over the past 2 years, several countries indicated that they are still working towards a greater role for pharmacy workforce in vaccination services. So those policies that they're working on include expanding pharmacists' role in both administering and prescribing vaccines, both for the vaccines, the 3 that we're discussing today, as well as for other vaccines, and for expanding the authority for pharmacy support personnel to administer vaccines as well. Other related policy development includes assuring consistency of authority across jurisdictions, as you heard Shirley mention earlier. Some countries, based on either states or territories, may have variation in pharmacist authority depending on where in that country the pharmacist is practicing. And then as well as looking at policies related to provision of either free of charge vaccines in pharmacy or remuneration policy in general, as well as access to an interaction with vaccination records, and removing any other logistical barriers that may exist. So overall, in the survey, 22 participating countries indicated that they are working on ongoing policy, legislation, and regulation development in this area. And so what we're going to do now is do an audience polling question, since we're talking about ongoing policy, legislation, and regulation development. And so we want to hear from you all whether the government in your country you think would support pharmacists' role in immunization services in your country. So we'll give you about 20 to 30 seconds. If you could rate your answers on a scale of 1 to 5. 1 is strongly disagree, and 5 would be strongly agree that the government would support pharmacists' role in immunization services.
AJ, we received quite a lot of number of participants already participated. So it's around 100, actually, 75.
Okay, great. Can you show the results then? Let's see.
Let's see. Very interesting, actually.
Great, so it's about spread evenly, it seems like. But when you look at kind of 3, 4, and 5, which is greater support, we are seeing kind of increased support there. So hopefully this is good news as we are advocating for pharmacists' role in immunization. All right, we also have one additional question beyond your government. What about other healthcare professionals in your country? So do other healthcare professionals support pharmacists' role in immunization services in your country? So we'll do the same thing, rate it on a scale of 1 to 5, 1 strongly disagree, or 5 strongly agree that your other healthcare colleagues would support your role in immunization services.
Same number as before, around 80, 85.
Okay, then let's go ahead and show that then. Great, so we can see it's a little bit different, maybe a little bit less support from other healthcare professionals, but it does still seem like there is some good support in that 3, 4 to 5 range where they're a little bit more supportive rather than not being supportive. And so if you are in a country where you think that they would support it, they can also be good allies when you're advocating for provision of immunization services. All right, next slide, please. All right, so vaccinations, as you know, are often recommended for different target population groups based on a variety of factors. So that could be age, comorbidities, increased susceptibility to the disease, or likelihood of exposure to that pathogen. And so this slide shows key target population groups that we asked about in the survey for diphtheria-tetanus-pertussis booster vaccines, COVID-19, and meningococcal vaccines. When you look at it overall, the largest difference in authority to vaccinate a target population group appeared to be based on patient age rather than on some of the other demographics or other considerations for the target population groups. And so there were a couple of countries who indicated that they had gotten their increased authority because of the low access for some of these target population groups. But overall, the survey seemed to indicate that it really depended more on the age of the person getting the vaccine rather than the specific population group. Another thing to mention, just like we talked about with administration authority, it also played out here. So authority to vaccinate certain target populations can vary in certain countries based on the jurisdiction that the pharmacist is practicing in. All right, next slide. All right, looking at remuneration. So there was considerable variation in how pharmacists and pharmacies are reimbursed for vaccination services related to diphtheria-tetanus-pertussis booster and meningococcal vaccines specifically. So as shown in the figure on this slide, the remuneration model in many countries who responded for those two vaccines in particular require patients to pay for services for both vaccines. In contrast, when you look at COVID-19, almost all remuneration for those vaccines occurs through third-party payers. So important to point out as well that several countries also have a hybrid structure where pharmacists and pharmacies may be reimbursed by a combination of third-party payers or patients paying, or in certain circumstances, they may not be reimbursed and the pharmacist or pharmacy has to absorb the cost depending on who that person is who's receiving the vaccine and perhaps what coverage they have or ability that they have to pay. So when you're looking at third-party payers, in particular, several countries indicated that pharmacists are reimbursed at the same rate as other healthcare providers for vaccination services, especially for the COVID-19 vaccine. But in a comparable number of countries, pharmacists are reimbursed at a lower rate than other healthcare providers, or were not reimbursed, like we mentioned earlier, and require patients to pay for vaccination services in pharmacies, which can be a barrier. And so I think that dovetails nicely into our next slide, and I'll turn it over to Dave to talk about some of those both drivers and barriers for pharmacy-based vaccination services.
Thank you very much, Elijo. So moving on to the drivers for diphtheria-tetanus-pertussis booster vaccination services, we found that pharmacists' desire to provide vaccination services was the most impactful driver across regions. This was followed by the availability of education and training, as well as patient demand. Patient demand was the most impactful driver in the regions of Americas, but least in the Europe region. And this was not reported as a driver in the other regions. And when it comes to barriers, in general, inadequate remuneration models or lack of them was the most impactful barrier selected. This barrier was ranked the highest in the Europe region. Limited acceptance and support by the government was the next impactful barrier, as you see in this slide here, and was found to be most impactful in the Europe region. So this summarizes basically the main drivers and barriers for the diphtheria-tetanus-pertussis booster vaccine. Now, moving on to COVID. Next slide, please. Pharmacists' desire to provide vaccination services was also selected as the most impactful driver across regions, especially in Europe. Patient demand, again, or the lack of access was also the most impactful driver selected in the Europe, Americas, and Western Pacific regions. When it comes to the least impactful driver in the Americas, Europe, and Eastern Mediterranean regions, it was the lower cost of pharmacist-provided services. And in terms of barriers to COVID-19 vaccination services, the highest ranked impactful barrier was limited acceptance and support by government or health system, as well as a lack of regulatory support. However, this was not seen in the Western Pacific region, which reported the most impactful barrier as insufficient pharmacy workforce capacity. So now let me move on to share on the meningitis vaccination services. As with the other two vaccines, pharmacists' desire to provide vaccination services was in general the most impactful driver, right? Specifically in Europe and Western Pacific regions. This was followed by patient demand, and it was the most impactful driver in the Americas region. Lower cost of pharmacist-provided vaccination services was the least impactful driver. Moving on to the barrier to meningitis vaccine, inadequate remuneration models or lack of them was the most impactful barrier across regions, and it was also highlighted the most in the Western Pacific region. And in Europe and Americas regions, the most impactful barrier was limited acceptance and support by the government or health system. And limited access to training opportunities for pharmacists was the least impactful barrier, and was only highlighted by the Americas region. So with this, I think we have talked a lot about the drivers and barriers for the vaccination services. And now let's move on to another poll. So pharmacists in my country are adequately trained and competent to provide immunization services currently. And I think as I spoke about the barriers to the various vaccination services, it's important for the pharmacists to be well trained and competent to provide such services. So do you agree that in your country, they are adequately trained and competent? So let's have a few seconds to participate in this poll. All right, Shirley, how's the participation? Are we ready to look at the responses?
Sure, Dave. We have around 80 now. Let's wait a couple of seconds. Okay, let me end the poll now.
Oh, great. So let's look at the results. So it's rather heterogeneous. We see that it's almost equal when it comes to agreement to pharmacists being well trained and competent to provide immunization services, right? So apart from being well trained and competent in the country, I think research and also report of the training programs is also very important. I think this is also to allow information for other countries to adopt best practices to train their pharmacists so as to implement such vaccination services in their country. So this concludes our session on the drivers and barriers. So let's move on to the next slide. So in this slide, we will share about how our findings will be visualized using a very interactive platform. So we will explain a little bit about the functionality as well as the current information and details of this platform. And I will welcome Shirley to play the video. Hi, everyone. I'll be sharing with you the visualization of the survey findings. You are now looking at the homepage of this interactive visualization platform. This page shows the overview summary of all the countries and territories that participated in the survey, And on the left side, you can interact to select countries with or without vaccination services based in community pharmacies. Likewise, you may also filter according to the different types of vaccines. So for example, if you want to find out if COVID-19 vaccine are offered at community pharmacies of which countries, you can select yes for COVID-19 and the country that provided these services will light up in the map. So this is the homepage, and there are also several other pages where you can navigate to view the results of this survey. So for example, on this page, you can view the data on vaccination services in community pharmacies, categorized into the various World Health Organization regions. Similarly, there are also data on remunerations, drivers of and bearers to the respective vaccination services like the diphtheria-tetanus-pertussis booster, the COVID-19 vaccination, as well as the meningococcal meningitis vaccination. So this atlas visualization is currently under development, and we are considering to incorporate country and territory specific information. So for example, back to this homepage, when you hover around the respective country or territory, it will pop up containing data specific to that country or territory. And you can also navigate to a page with more details and information. So this sums up the interactive visualization. Thank you. So I hope you have gained a deeper understanding of our survey findings with regards to the DDaP vaccination, COVID, as well as meningitis. So now let me give the time back to Chris, who will take you through the other parts of this webinar. Thank you.
Thank you, Dave, and thank you to Shirley and Alijo for taking us through all the parts of the project. Our report, Advocating Expansion of the Pharmacist's Role in Immunisation, will be out on the 28th of April 2022. So that is this Thursday. Please stay tuned to social media and other communications channels and our website, the fip.org website, for accessing the report. It will provide a lot of useful evidence of pharmacists' impact on improving vaccination coverage globally and show that the role is growing. The COVID-19 pandemic has provided further affirmation of the accessibility and availability of pharmacists as frontline providers of people-centered care. And beyond the pandemic, efforts to support and expand pharmacy-based vaccination services must continue as a necessary route to achieving universal health coverage. So our report, a reminder, will be launched on the 28th of April. There are a number of impactful drivers that have been found that enable the role of the pharmacists in vaccination and immunizations, and they're found in the report. These drivers can be adopted or encouraged by members of the profession globally, especially those who seek to expand the role of the pharmacist in those countries where there is no current pharmacist involvement in vaccination. Similarly, this report identifies common barriers to pharmacist involvement, and strategies can be developed by the profession that focus on removing these barriers. So it's a really vitally important collection of data that can help the profession globally expand the role further. So in a few years' time, we hope to be talking of an even greater role of the pharmacist in vaccinations. So thank you very much. We're going to move onwards, and I'll hand back, I think, to Manjari.
Thank you so much, Christopher. Thank you, Christopher, Shirley, Zing, and Ali for this fantastic overview of the project. And stay tuned for the report, which is coming up this week on 28th of April. Now we are coming to a most interesting and exciting part of this digital event. And we have panelists from 6 countries. And as Shirley already informed you, the countries for this panel discussion are selected from the respondents of the project. And so these countries are at different stages of the vaccination. And so they represent they give a very broad overview of the vaccination progress. So I'm pleased to introduce all these colleagues right now. We have Mas Rahman Rostan from Indonesia, and he is Operational Director of Biopharma Company, the leading vaccine manufacturer in Indonesia, and Expert Council of Indonesian Pharmacist Association. We welcome Mas Rahman. Then we have Zishan Sujata from Malaysia. He is the Honorary Assistant Treasurer for Malaysian Pharmacist Association, MPS, and member of MPS Immunization Advocacy Chapter. We have Dr. Rula Darwish, and Rula has replaced Zaid Kilani, as Professor Yan already informed you. Thank you, Rula, for joining at the last moment. Rula is president of Rula is the chair of Continuing Professional Development Committee of Jordanian Pharmacist Association, and she's the professor at University of Jordan. Then we have Karin Wolf-Thal from France, the community pharmacist and the chair of the National Council of the French Chamber of Pharmacists. And she has played a major role in advocating for the role of pharmacists in immunization. We have from Argentina, Irma Brits Caponi. She's the director of an independent community pharmacy and past president of the local branch of the Chamber of Pharmacists of Buenos Aires. We have from South Africa, Sham Woodley, and he's the representative from the Pharmaceutical Society of South Africa, vice chairperson and member of the board of directors of Independent Community Pharmacy Association of South Africa. So again, welcome all the colleagues, and we are looking forward to know from you your advocacy efforts and the situation in your own respective countries. So I go first. My first question is to, hello. Can I have the next slide? Can we have my question will be to my colleague from Indonesia, Mas Rahman Rustan. Can all the panelists start their video, please? I request all the panelists to start their videos. Can we have the video on for all the panelists? Irma, Z, Mas Rahman, Dr. Rula, Sham.
Yes, Manjiri, we have everyone open the camera already.
Yes, okay, great. Thank you. So I couldn't see it, Shirley. Thanks for informing. So my question to my colleague from Indonesia, Mas Rahman. Currently, pharmacists are not able to administer vaccines in Indonesia. That's the same situation in India too right now. So what do you think is currently the biggest barrier to expanding pharmacist role in vaccination services? I hope you got my question.
Oh, yeah.
Yeah, please go ahead. Okay. Thank you. Yeah.
Thank you for the question. Dear colleagues and friends, good morning, good afternoon, and good evening, everyone. Allow me to express our gratitude first to FIP and International Pharmaceutical Federation to inviting me to this very important occasion. So it is our pleasure to share our experiences in approaching the related stakeholders, especially the Ministry of Health. Ministry of Health in Indonesia recommended that medical doctors, nurses, and midwives be authorized to prescribe and administer vaccines, but not yet authorized to the pharmacist. The biggest challenge is to convince the authority that a pharmacist has a capability to support the vaccination program. Since the Ministry of Health not yet recognized that a pharmacist also has an important role in vaccination or vaccine administration. So we have around 90,000 members, and we register around 500 of them has filled the form ready to be trained as vaccinators, and it will be more. We keep in touch and still communicate with the authority to convince them that we are ready. Just for additional information, the authority recognized that a pharmacist has important roles in vaccine availability in Indonesia in terms of vaccine research and development, manufacturing, distributing, and handling during a vaccination period. Pharmacists also involved in vaccine clinical trial, collaboration among partners, which kind of learning for scientists and researchers how to manage the preclinical and clinical trial to be effective and efficient. Another important role of pharmacists is to educate people about vaccine product characteristics and vaccination socializations. So this effort is to support the Ministry of Health immunization program in Indonesia. I think the biggest challenge is how to convince them over.
Thank you so much, Rahman. And I can relate to this situation in Indonesia, because as I said, in India too, we have so far made no progress in involving the pharmacist in the vaccination. And one of the biggest issue is convincing the policymakers and showing the capability of the pharmacist. And then comes the education and training later. Okay, thank you very much for your insights. Professor Yan, would you like to, go ahead.
Thank you very much. So I'd like to address this question to Jisan Sejuta from Malaysia, who is a member of the Malaysian Pharmaceutical Society Immunization Advocacy Chapter. In contrast to what we've just heard, pharmacists are able to administer vaccines at vaccination centers in Malaysia. What do you think was the most impactful advocacy message that helped to convince the Ministry of Health to allow and indeed to encourage pharmacies to take place?
Thank you, Prof. Ian, for the question. Thank you to FOP for inviting me as well. So I think it's not just a message, but a series of messages that we managed to put out, not just during COVID, before COVID as well. We had already formed this small working committee, and then we had discussed the possibilities of pharmacist vaccination with our colleagues from the Pharmaceutical Services Program, Ministry of Health, and not only the pharmacists, we also talked to the doctors as well to get their input. So throughout COVID, we also tried to arrange meetings and discussions with the people who are in charge of vaccines, especially on the COVID-19 vaccine distribution, as well as the people in charge of handling the vaccination centers. Because Malaysia is a national immunization program for COVID-19. So we also sent letters to the Deputy Director General of Public Health to get their support, and they wrote back quite positively. And moving forward, we also invited the Minister of Health to our pharmacy conference and managed to have further discussions on that. So it happened over a course of 1 year before they finally recently agreed that pharmacists can be allowed to be vaccinated at the COVID vaccination centers, which is handled by one of the organizations in Malaysia. So apart from all these meetings, or to put it in more crude way, all this lobbying, we also work together with the university, a local university, Science Malaysia, to work on a vaccination program in parallel to all these discussions. So it is a professionally developed program run by university in collaboration with the Malaysian Pharmacists Society, so that when the government has agreed to give us a green light, we can say, yes, we are ready. We already have a training program in place. We can train pharmacists in a moment's notice if there is a demand. And of course, and last but not least, fortunately or not unfortunately, due to the Omicron wave, which resulted in a surge of cases and requiring a lot of people to get a booster dose as well as the students' immunization program. I think the government also realized they needed more help, not just from the doctors and other staff from the Ministry of Health. So they also wrote in pharmacists, especially community pharmacists, to be part of the program. Yeah, so I think this is a series of advocacy efforts that led up to the government finally agreeing to allow pharmacists to administer the COVID vaccine. Yeah.
Thank you so much for that. I think in summary, that was about consultation and communication, especially with the Ministry of Health, and getting those relationships established particularly about the capability of pharmacists. I think that was a very powerful message. Thank you so much for that. Back to you, Manjiri.
Yes, thank you. And it's my pleasure to now address a question to Jordan, Dr. Rula. See, in Jordan, I know that pharmacists are able to administer the influenza vaccine. And recently, they are also now they can also administer COVID-19 vaccine. So that's progress made. So how do you think the pharmacist vaccination efforts during the pandemic will impact further advocacy for pharmacists to administer other vaccines? That means basically broadening the role of the pharmacist further in the area of vaccination. Dr. Rula.
Thank you, Manjiri, for the question. And thank you, FIP, for giving us the opportunity to share our experience in vaccination in Jordan. To answer the question, Manjiri, yes, we believe the impact was quite high. Actually, pharmacists in Jordan proved that they are qualified and have high degree of professionalism. They proved that they can not only have important role in decreasing community transmission diseases by increasing public awareness among general Jordanian population through counseling, referring, avoiding panic, but also by direct intervention through vaccination. And of course, this has been done after thorough training, not only on how to deliver the vaccine, but also knowing how to deal with the adverse effects if it happens, like, for example, having courses in CPR and first aid training. In COVID-19, actually, more than 1,500 pharmacists were further trained by Ministry of Health and were involved in vaccinating the population. Moreover, pharmacists volunteered in the vaccination centers where they administered vaccines and make sure the storage conditions was right, quality was assured, and administration of vaccines and they were also involved in population advocacy and giving advices and counseling for the patients. Also, all this have improved the acceptance of public for pharmacists becoming a vaccinator. In fact, JPA worked on advocacy for pharmacists to administer vaccines even before COVID-19. And vaccination campaigns were conducted by a group of trained pharmacists in different settings. JPA has also made several workshops and published guidelines for vaccination and have approval from pharmacists from Ministry of Health to be accredited to give vaccines for public for certain vaccines, of course. Also, we did some studies in relation to the question, which has been published in reputable journals like Journal of Pharmaceutical Health Services and Pharmacological Research Perspectives on perception and attitude of the public on vaccine practice and pharmacists as immunizers in Jordan. And the results showed that the public approved on pharmacists to become immunizers under certain conditions regarding proper training, accreditation, accredited certification, and licensed administration facilities. Another study was, on the other hand, studying the community pharmacist workforce readiness to deliver vaccination services. And here also, the study emphasized the need for proper training and preparation for the purpose. So we believe what is needed to be worked on later is to work on different levels, which includes the policymakers. They should provide proper legislations that allow the certified pharmacists to become immunizer if they fulfill, of course, certain requirements. Jordan Pharmaceutical Association to deliver proper training and certification for pharmacists to be able to practice as immunizer, and also provide continuous professional education and continuous assessment at the same time. A school of pharmacists, they should emphasize more on theory and practice of vaccine in different courses. Public education, which emphasize the role of pharmacists to be part of healthcare providers that can apply vaccines. Also, pharmacists themselves to have the proper competencies to prepare their pharmacies as well to accommodate vaccination. Thank you.
Great. So it's really nice to see that you have put down the role of every stakeholder when you want to take the next step. And so it's the policymakers, the educationists, as well as the JPA and public as well. And I can also see your success story is very interesting. And during COVID-19, pharmacists showed the evidence and action. So that's how the policymakers also now have realized the value of the pharmacist, as well as public has endorsed the role of pharmacists as vaccinators. And I'm impressed to see that the ADR reporting has been done by the pharmacist and they continue to do so. The adverse drug reaction reporting. So good luck and congratulations for the progress made in Jordan.
Thank you, Manjeri.
Yeah. Going back to Jan, Professor Jan. Yeah.
Thank you, Manjeri. My next comment and question is directed towards Karine. Bonjour and welcome. Thank you for joining us today. Karine is chair of the National Council of the French Chamber of Pharmacists and has played a significant and influential role in vaccination and implementation in France. Karine, earlier this year, the French Authority for Health did recommend that pharmacists, nurses and midwives should be able to prescribe and administer certain vaccines like diphtheria, tetanus-pertussis, plus others. Can you elaborate on what advocacy efforts you went through in order to get this recommendation pushed through the Ministry of Health and for expanding pharmacists' role? And what are the next steps for you over there in France for this major policy in public health?
Well, first of all, thank you for FIP for organizing this webinar and then for inviting me talking about this topic, which is actually my favorite one. So your question is very large, and maybe I can introduce saying that the last part of your question, actually, we just got the last regulatory text this last weekend. So probably our government heard about this webinar and gave me the opportunity to announce that now France is allowed to vaccines all those vaccines that were suggested in January. So anyway, how we started and how we advocated, it's mainly, I would say, the strength of evidence. And second thing is probably progressive process. As you may know, we started by an experimentation, which is really the way I recommend to go through, and start with just flu vaccination, a vaccination which is a very low risk, I would say even no risk at all. And this is by proving what this vaccination can bring to the population, but mainly to public health, that you show how pharmacists can help. So we started by this experimentation, and it was so successful that this experimentation that was supposed to last 3 years, actually we cut it into 2 years, because it was such a success that an evidence that the government allowed us to vaccine in all the territories against flu. And it was not so long time ago. It was back 19. So it seems like a long time ago, but it's just 2 years ago. And then what happened is obviously the COVID vaccination, and then we have been allowed to vaccine against COVID back in March 21, and we vaccine 15 million of patients. So it's really the strength of evidence who convinced the government a couple of months ago for giving even more to the pharmacists. What helped us a lot also is the patients and the population desire to go to the pharmacies. Again, the evidence show that pharmacists are available everywhere on the territory, open 6 days per week, large hours, and available without appointment. And the population really liked it. And that was also a strong evidence and a strong push for us to be encouraged to do even more. Last also thing is during COVID, we were also in charge of distributing vaccines to our other colleagues, professional like GPs, nurses, midwives. So we showed that we were not only able to prescribe, administer, but also organizing the whole distribution and being in charge from A to Z to this vaccination. So really, the pharmacists were very willing to take part on this vaccination and on this large program, and therefore, because there was this public health problem, which is not having enough coverage for this vaccination around the territories, then it was like an evidence and no other choice than, or actually the best choice, to give the pharmacist the opportunity to do those vaccinations. So as I was saying in introduction, this just arrived this weekend, so I'm very happy to share this important news with you today.
That's absolutely amazing, Corinne. Thank you very much for allowing us to hear that news first. And I think, to summarize your message, evidence-led is the way forward. That's certainly an FIP policies, to use evidence to advocate and to be impactful, but also the patient's voice is so very important these days. Amazing insights. Thank you very much indeed. Over to you, Manjari.
I would like to address my question to Irma from Argentina. Irma, pharmacists in Argentina can administer all vaccines registered by the National Regulatory Authority. So it includes diphtheria-tetanus-pertussis booster as well as meningococcal meningitis vaccine. How do you perceive pharmacist impact on vaccination rates for these two vaccines particularly?
Hello. Good morning, everyone. Good afternoon. First of all, I would like to thank FIP for the invitation to this webinar. And I would like to thank COFA authorities for trusting me for this task. I would like to make it clear too that this presentation was in charge of my colleague Liliana Nogueras, who couldn't be present for personal reasons today. So I am here on her behalf. Pharmacists in Argentina can administer all the vaccines, included the national schedule. I should like to highlight that for diphtheria, tetanus, and pertussis, the vaccine in the national vaccination schedule is the cellular pentavalent one. Meanwhile, in community pharmacies, we have the hexavalent acellular vaccine available. Therefore, the administration in this vaccine is highly required by pediatricians and parents because of the fewer side effects. To sum up, some patients have social security coverage or prepaid medicines that rate from the full 100% coverage, and in other cases, the payment ranking from 40 to 70 or 80% in payment of the vaccine administration. Therefore, the incidence in the rate of vaccination coverage for boosters, especially for the first one at 18 months made by community pharmacies, is important. In the case of the second booster at the beginning of primary school, the incidence of community pharmacies decreases because there are several vaccines that should be administered together, and this is realized in this is done in the public system. Although the large number of patients attend to pharmacies to receive the quadrivalent vaccine, those with the triple bacterial component acellular plus the Salk vaccine. And in the case of the 11-year-old booster, we see a decrease in the contribution that we community pharmacists make because the vaccine has already become the triple bacterial acellular for the national vaccination schedule that is completely free of charge. It is the same vaccine that we have available in our community pharmacies, and that will require a copayment of a different percentage by this time. In adult population, where the booster must be applied every 10 years, the activity carried out by community pharmacies is very important due to their proximity to their knowledge of the community, constantly asking questions, reviewing the scripts, advising patients so that they can keep the vaccination schedule on tetanus and diphtheria updated, and do not have to go out with emergency rescues in an event or an accident or a scheduled operation. Actually, in our country, there is a lack of monitoring on the vaccination schedule of adults by medical professionals, a lack that is minimized by the role of the community pharmacists, advising and reviewing scripts of patients who belong to their community. Community pharmacist role is also very important in the recommendation of the triple acellular bacteria vaccination to pregnant women. Many times women come to our pharmacists because they are neighbors, and we discover by chance that they are not correctly vaccinated as the requirements of pregnancy women. At this point, it is important to emphasize that obstetricians carry out an important follow-up of the vaccination status of pregnant women, but unfortunately, there are a number of pregnant women who do not approach the health system while they are undergoing their pregnancy. And now again, it is the community pharmacist who advises and recommends it and finally administer the vaccine. Unfortunately, our country has lost vaccination coverage in the last years. Important post-pandemic campaigns are being carried out to recover even the most important loss that was manifested in the year 2020-2021. Hence, our role of community educator is crucial because it is very important for our country to recover the vaccination coverage that we had previously had around the year 2009-2010. In the case of the primary screen for diphtheria, tetanus, and pertussis, vaccination cover is around 85%. It drops notably to the 33. And then this coverage is recovered when the child is 5 years old to values of 84 or 85. They are also sustaining the booster at 11 years old. As you may see, it is very important to recover values above 90% historically reached by our country. Regarding meningococcal vaccines for the primary screen, in the case of the quadrivalent, the same vaccine that is in the national vaccine schedule is also available in community pharmacies. In this case, pediatricians may decide to start a scheme 1 or 2 months earlier to those established by the national vaccination scheme, also to retrieve primary stream. The incidence of the community pharmacies in the coverage rate of meningococcus is very important, mostly due to that of this vaccine. The third-party pay plan on the maternal and child plan is full paid in our pharmacies for the primary schedule. Then, for the 13-month booster, we have different coverage for different securities or prepaid systems with a copay. Therefore, in the booster, the contribution to the meningococcal vaccination coverage by community pharmacies decreases. And in the case of the 11-year-olds and up, the incidence is seriously diminished because this booster is applied together with other vaccines. They are expensive ones, and they are at the same time in the public sphere. Regarding the administration of Vexero vaccine, against meningococcus B, it is not in the national vaccination schedule. It is highly indicated by pediatricians where the entire percentage of vaccination cover is provided by the private sector, mainly by community pharmacies.
Thank you, Irma. Thank you for these insights and congratulations for the work done. And I can see that the pharmacists are making the difference, but sometimes the policies and the public health policies and the coverage given by the government may affect our performance, but pharmacists are doing a great job by referring the patients and improving the vaccination coverage. Thank you very much for that piece of information, and thanks for representing on behalf of Lilian. Thank you so much. Professor Yan?
Yes, thank you, Manjeri. I'd like to introduce Sham Moodley from South Africa. Sham is representing the Pharmaceutical Society of South Africa and is the pharmacy lead on the National COVID Vaccine Task Team. So congratulations on that, Sham. I'd like this question to go in a slightly different but related direction and ask you about more of a sort of societal clinical matter in a way. You have very broad authority in South Africa for being able to administer vaccinations. But what, in your opinion, would help enhance public uptake of vaccination and better national coverage rates?
Thanks, Ian, and thanks to FIP for this invitation to represent from South Africa. Good afternoon to everyone from a very cold Johannesburg. I think the thread that is running through the discussion today around various policy issues is interesting because it's kind of where we've taken the South African platform over the last 3 years, especially through the COVID vaccine program. I think the first issue is for countries to examine their education policy. So within the university framework, what we're trying to encourage is that every pharmacist comes out of university with full competence to administer vaccines. And this is really a public health competence issue, so that they would need no further training, except maybe some CPDs on very specific areas, like, for example, COVID, on managing those vaccines, or on any one of the other vaccines we've discussed today. So the first issue is a change in the education policy, and some of our universities are already starting to include that and allow for full competence when they do come out of university. The second issue is for organizations to come up with their own policy framework within a country to foster belief in the fact that pharmacists can do it. Because if we don't believe in ourselves, we're not going to convince the players that are fundamental to change to be part of it. So I think the policy framework within each of our organizations, especially the 140 some odd FIP organizations, need to have their own policy framework and structured well. Next is to try and facilitate recognition by government on the key role of pharmacists in public health. I think this is really an important and critical area, and we've demonstrated that quite adequately in the COVID vaccine program, not only in South Africa, but internationally. Just in terms of some numbers in South Africa, we've administered about 7 million vaccines at a community pharmacy level. This makes up about 90% of the private sector work outside of what government is doing, and it makes up about 22% of the vaccine administered in the country so far. Another good example of it is a public-private partnership, unfortunately not with the whole country, but with just one province in South Africa, which is in the Western Cape. And the data that I pulled out for this meeting is that 22% of all vaccines in the age group 0 to 1 is done in a public-private partnership, with a pharmacy taking on the major role in this campaign. So I think the policy in terms of how you manage your provinces or the national structure is important, and you need to present them with a consolidated approach from a pharmacy point of view to make them believe that you can get this done. The next area, I think, is possibly within the pharmacies themselves, in the practice models themselves, to trying to imprint in the minds of patients that pharmacists and the pharmacy itself are really the destination for vaccines. So it's another policy framework we should advocate in, that we become the destination for vaccines in the future. And I think the COVID example really in South Africa really took off, where if you ask someone in the public now, where are you taking your vaccines? And they'll say to you, at a local pharmacy somewhere. My last point is around policy issues in terms of scheduling. So one of the areas that we've really failed in is in the area of meningitis, for example. And I do think that if we are able to convince the regulator to change from scheduling it in the higher area where you need a prescription, to scheduling it within the framework of pharmacy, like we do with the flu vaccines, for example, then this can be freely administered where patients, the more mature patients or patients that are at risk, need access to the meningitis vaccine. My last point on this, and I think this is critical, is that to continue to engage both with your regulator, those that make policy around pharmacy, and with government, and to provide them with viable solutions, pharmacy solutions that impact on public health. I hope that was useful, Ian. Thanks.
Thank you so much, Shyam. That was really very impressive. And I cannot agree more with you when you say the destination for vaccination should be pharmacy. Yes, and I also, I think it's a great learning to know that the public-private partnerships worked very well in South Africa involving the pharmacist for vaccination. So I think that is great learning for all other countries too. So thank you very much for that information and the insights. Thank you to all the panelists for your very useful insights. Now I have a common question to all of you. From our discussion today, we can all agree that the pharmacists have an important role in public health to protect our communities and to support the achievement of long life for all. If you had to give one piece of advice, just one piece of advice, a minute for it, to others who are advocating for the pharmacist's role in vaccination services, what would it be? So I repeat my question. If you would like to give one piece of advice to all those who are struggling to establish or develop the role of pharmacist in their countries in vaccination, what could it be? So you have a minute for it. Thank you so much. So may I start with Indonesia, the same sequence as we followed? Mas Rahman, can I?
Yeah,
please
thank
go
you.
ahead.
Thank you, Manjari. So with the fact that Indonesia, perhaps same with position with colleagues in India, as mentioned by Manjari, we need to set some strategy in parallel internally in the country. Starting from the university, vaccine administration needs to be introduced to pharmacy students and pharmacy technicians. Simultaneously, the authorities should be approached that pharmacists are capable and has an important role in vaccination. It will be helpful if the result of the if IP study shows that, if I don't mistake, 31 countries allow pharmacists for vaccine administration are also distributed to the Ministry of Health, particularly to the rest of the country which not yet recognize this potential resources for increase the vaccination coverage. Thank you.
That's right. Thank you so much. G, would you like to comment further? Zishan?
Hi, thank you, Manjari. I think my own opinion is that we pharmacists have to have the strong belief that we should step out of our traditional roles of dispensing, play a more active role in the healthcare service. And I think vaccination is one of the most appropriate way forward that we can actively participate to establish a better health system and to protect the public from vaccine preventable diseases. So with that belief in mind, to expand the roles of pharmacists, I believe with that be a strong driver for us to push for more pharmacists to administer vaccines in the affected countries. Yes, thank you.
Yes, thank you so much. Dr. Rula, it's your turn.
Thank you, Marjini. I think the most important thing is to start strong in a way to provide training. Trained, competent pharmacist is very important, with continuous professional development all the time and with continuous assessment. This is to start with. Again, to gain the trust of the population. As we said, the patient's voice is very important. So gaining the trust, and I think this is very easy for the pharmacist with all this access for the population. Also addressing all the stakeholders, starting from the beginning, from the curriculum, we need a strong graduated pharmacist. We need connections with the ministry policymakers. We need with the public, as I said, all stakeholders should be involved in the right way. Also, guidelines is very important, I think, to control the whole process. You have to have guidelines. So you have to have a plan, in other words. You have to have an action plan and start working on each item, and then you present your project. I think this will be my advice. Thank you, Marjorie.
Yes, very useful. Thank you. Karin?
Well, many things have been said already. I would say, again, start with an experimentation with a pilot, mainly on a flu vaccine, because that's the easiest at the lower risk, and then show the evidence. And then I would say, use the data and the report provided by FIP, showing all this success all over the world, and say your Ministry of Health, well, we don't want to be the last country to allow pharmacists to vaccines, show everywhere the proof, and then make it in our country also.
That's right, yes. Irma? Irma, are you there? Yeah.
Okay. Pharmacists are university professionals who are close, trusted by different communities, neighborhood, and people. Therefore, people constantly require our advice and assistance or support to their health problems. In the case of vaccination schedules, the pharmacist in our country is fully academically trained to know the composition of each vaccine, the indication of each vaccine, the primary vaccination schedule, the boosters of each vaccine, in addition to being trained for the correct administration of them. Therefore, we believe that the role not only of vaccinating, but also of communicator and advisor to the community regarding the importance of immunization for vaccine-preventable disease is extremely important. It is highly appreciated by the community, who really knows the role of the pharmacist in our country. In this point, the influenza vaccination campaigns that were carried out for years for the main social work of our country, or the coverage program from retirees and pensioners in our country, have really collaborated a lot, as well as for the provincial social work, where it has allowed this role to be recognized. This important activity carried out by community pharmacists. We really work permanently to strengthen prevention from community pharmacies, improve the style and quality of life of our patients. And it is the case of the role as vaccinators. These campaigns that are carried out annually have allowed us to position ourselves and stand by our community. So I say the same that my previous colleague, use this data to let this work known.
Yes, great. Thank you so much. And I come to Sham. Hello. Yes, Sham.
Thanks, Manjira. I think for me is to ensure that in each of the countries, we find a seat at the table where public health policy is being formulated. And that is the government, either regionally or nationally. And the second big player would be our regulator, and to ensure that when they're designing scopes around pharmacy, that we are at that table to determine what those scopes are, because we know what our qualification is. So that's my point here, is that find a seat at the table, and that will take us forward. Thanks, Manjira.
That's right. Find a seat at the table. So be at the table where the public health policies are decided. And so we have to be very confident and strong. Thank you so much, all my colleagues, for this piece of advice and your insights. Extremely useful. I can see excellent feedback in the chat for your information that you have shared with all of us. So again, very sincere thanks to all of you, all the panelists. Thank you so much. Moving ahead. Yes, Shirley. So we are coming to the last part of the webinar. And before I tell you about the conferences which are coming up, I want to thank my co-moderator, Professor Ian, who could not be here till the last moment. Thank you, Professor Ian, for all your support to this webinar. So now it is an exciting time to tell you about some of the conferences which are coming up. The first one in July, FIP Pharmacy Practice Research Summer Meeting for PhD students, postdoctoral fellows, university professionals, and all other pharmacists who are interested in research. So that will be held in Netherlands on 4th and 5th July 2022. So please go to FIP website and register for this summer meeting. The next one, Yes, and after 2 years of gap, we are going to have the FIP Congress, 88th FIP World Congress of Pharmacy and Pharmaceutical Sciences, and that will be held at Seville, Spain, between 18 to 22nd September 2022. So after 2 years of gap, this is the opportunity to meet face-to-face, exchange ideas, and meet all your global families. So I appeal to all of you that please register, please make a plan, and would like to meet all of you in Seville in September 2022. Next one. The role of community pharmacists in the vaccination, opportunities and supply chain challenges in a post-pandemic scenario. So next to this, in continuation kind of to this webinar, today's webinar, we'll have another exciting and interesting webinar on April 26th, and that is at 1 p.m. Central European time. So please do not miss that, and please register for this next FIP event. Check all our future digital events at events.fip.org so that you don't miss any and you stay updated and stay tuned with to us within the FIP. So thank you very much to all the panelists. Thank you very much to all the
Manjiri, I think we lost you while you're closing the webinar. Is it only from my side?
No, we lost you.
Oh, okay. I think I will take over. Thank you very much everyone for joining our events today, and thank you very much for our member organizations who participate in our study, for our for Sanofi, Pasteur, and also for all of the panelists today for your time. Oh, I think Manjiri is back now. But anyway, since the time already finished as well, so I would like to thank you so much for all of you to join our digital events today, and hope you find the information helpful and useful, and have a good day everyone. Thank you. Bye. Happy World Immunization Week.
Thank you, Shirley. Thank you, everyone. Good day.
Everyone, bye.
Bye. Thank you.
Bye, everyone.
Bye. Bye,
Bye,
Syam.
everyone.